Hi everyone. Katie from Katie Risotto Fitness has asked me to come on and chat to you all about the importance of seeing a women's health physio before returning to exercise, and more importantly, high impact exercise or strenuous exercise. I have a lot of my patients that come into the clinic who just sort of find me themselves. Some of them have been referred by GPs, some of them have been referred by their obstetrician, but you don't need a referral. You can just bring yourself in for a very basic 6-week postpartum checkup. Generally, what I would do in that checkup is ask a little bit about your most recent delivery and ask about any other deliveries you've had, how many babies you've had altogether, whether that was a vaginal birth or cesarean delivery, if there are any complications, if you had any tearing or any instrumental delivery. This is all important because it tells us about the quality of your pelvic floor and what sort of stretch it might have had during your delivery, what scars you might have, whether that be perineal or C-section, because this all contributes to your recovery postnatal and then your return to exercise. After this, I'll normally ask about a surgical history, if you've had any major surgery apart from C-section, if you are on any medications, and your general health as well, if you're regular with your pap smears, if you have had any recurrent UTIs or thrush, if you had any preeclampsia or diabetes or high blood pressure during your pregnancy. So we get the whole picture of, even if I hadn't seen you during pregnancy, of what it was like for you during your pregnancy and also your delivery. Then after this, I normally ask about your bladder function and your bowel function and your sexual function. Very often at 6 weeks, most people haven't returned to intercourse, and that's absolutely fine. I literally have a box that I tick, hasn't tried since delivery, and that is very normal. If you have tried and it's been uncomfortable, then that's also something we can chat about. Bladder function is also really important because that tells us if the bladder is supported well, if the muscles are working the way that they should to hold on to the bladder contents, and same for bowels. If the bowels are working well, if they have been affected by your milk supply and your fluid intake, are you passing bowels easily without pushing and straining, because that can be damaging for the pelvic floor. When I explain to you the pelvic floor muscles, I usually use a pelvis like this, just the skeletal bony pelvis with the pelvic floor muscles in the base. You can see where they attach at the front, the pubic rami, and sling right through to the back to the coccyx with lateral attachments off to each side, creating that bowl or that trampoline that the pelvic organs sit on. So bladder at the front, vagina up to uterus in the middle, and rectum up to bowels through the back. You can see where that pelvic floor switches on and lifts. It creates a closure through each of those passages, so it helps hold on to bladder contents. It has a sexual function squeezing in through the middle, and it holds on to bowels and also lets go of bowels when it's needed. Returning to exercise is really important that these muscles have enough strength and power so that they can perform those functions while you're exercising. It's very common that they're a little bit weak after pregnancy because they've had 9 months of stretching and then possibly had a big stretch with a vaginal delivery as well. So that's why we do the check, to make sure that you're safe to return to exercise. You're not going to further stretch those muscles and experience symptoms through each of those organs. So the last part of the assessment is a vaginal assessment to have a look at the pelvic floor muscles. Normally I just observe from the outside first and get you to do a nice pelvic floor lift with all the cueing that I've given you as to how the pelvic floor muscles work. Are you able to lift and draw in, and can I see that lift up in the pelvis and the perineum lift up? What happens when you do a cough? Is there any perineal descent, so that movement downwards? Is there any prolapse that present? And the same for a Valsalva or a gentle bear down. Is there any movement downwards? That's quite obvious, because this could be happening when you're exercising, particularly if it's a little bit too strenuous for you or if you're returning too soon to exercise. I also am feeling for power and strength of the pelvic floor muscles. So just with my finger at at the entrance of the vagina. I'm feeling for the superficial perineal muscles, and a little bit further forward I feel the deep pelvic floor muscles. And how hard can you squeeze that pelvic floor muscle out of a grade of 5? How long can you hold for? How many reps can you do maintaining this strength? I also have a look at quick contractions, because this is what we need when you cough and sneeze and jump and lift and walk, which is what you're doing with your baby and in exercise. From this, I'm able to give you a pelvic floor program that you can do at home. I give you guidance as to how often is reasonable for you to be able to do this, given that you have a new baby, certain times that you could easily fit this into your schedule, and it's based off what your capabilities are at that time. And then we can build on from that depending what your goal is. So your goal might be different if you're wanting to return to Pilates compared to if you want to return to cycling, compared to if you want to do something more high impact like CrossFit or gym classes or running, for example. We need to make sure that the pelvic floor has the strength and capacity to withstand those sort of activities. And I also give you some guidance as to what to look out for. So if you're asymptomatic, you might feel okay, but watch out for urinary incontinence, any feeling of heaviness or lump or bulge down through the vagina indicating prolapse, any pain down through that area, any pain through the abdominal muscles, and also, are you able to breathe through your exercise? It shouldn't be so hard that you're holding your breath, because that's going to put more pressure down through the pelvic floor. I hope this has been really helpful in letting you know what we would do in an initial assessment, and I'm always happy to see anyone postnatally.